morning to the person that just joined. And I hope you are well and safe from wherever you're viewing this. The date is April 24th, 2020. And I just posted something to my Facebook page at All Things Neonatal. And I thought it was worth having a quick chat about communication during COVID-19. So for those of you who follow the Facebook page, you might have seen that I just posted a paper entitled Late Onset Neonatal Sepsis in a Patient with COVID-19. One of the challenges that we have is when you produce a paper like this and you see that COVID-19 can present with late onset sepsis, which is what happened in a 36-week gestational age infant who presented at 3 weeks of age with signs of sepsis and ultimately had pneumonia, a pneumothorax, and ultimately tested positive for COVID-19. And this got me thinking, what is the healthcare provider to do in the era of COVID-19 when you get late presentations like this? We see we see pneumonias, we see late onset sepsis, we see pneumothoraxes, not uncommonly in the neonatal intensive care unit. And given that, how do you as the practitioner, how do you as the nurse, or the family member raise the question, could this be COVID? And I should mention, as I see more people joining, if you like what you see, please hit the like button. Feel free to share this because communication is important. And I think more now than ever, when we're thinking about how to manage patients like this, what we really need to do is make sure everyone's well informed. So how do you manage this? How do you manage issues like this in the age of COVID-19? Well, the easy answer would be one could do swabs on every single patient who presents with late onset sepsis. And they could look for COVID-19. If you're like our unit, the problem with that is the moment you start doing swabs for COVID-19, you're going to run into the issue of isolation. How many isolation beds do you have? How many single patient rooms do you have? What if you're in an open bay and you're swabbing everyone left, right, and center for COVID whenever they present with signs of sepsis? And so I think this is where communication comes in. Even though we've moved past the era where we were just worried about travel-related COVID infection, we now have community spread. So the importance of speaking to your obstetrical colleagues cannot be emphasized enough. Really look at the history of the parents. Look at, have they traveled? Look at whether they have any symptoms. Recognizing that some people present as asymptomatic certainly is a challenge, but it doesn't mean that we have to completely do away with good history taking. While it is possible that a mother could be asymptomatic and a father could be asymptomatic, for a child like this, I suspect with severe disease, as reported in the New England Journal, it wouldn't be that surprising that the majority of these patients would be born to families families who have been affected by COVID and are symptomatic. So I think that there's no easy answer to this, and I wish everybody out there well, because this really did get me thinking, what will you do at 2 weeks of age or at 1 week of age with a child who has a respiratory deterioration? Clearly, we're not going to be able to swab everybody. We're not going to be able to treat everybody as possibly COVID positive. And so I think now more than ever, it's going to be important that as a team, not just as a neonatologist or as a nurse, but as a team, you discuss this. Discuss it with your infection control and prevention groups, and figure out when it is appropriate and when it's not appropriate to do these swabs. The last thing that I would mention is, especially if you work in a level 3 or level 4 neonatal intensive care unit, one of the things that you're really going to have to consider is, what do you do for your kids with chronic lung disease? Chronic lung disease, depending on who's watching, certainly has varied presentation. There are days that are good, there are days that are bad. We know that some days we will have high oxygen requirements, and other days you'll have lower oxygen requirements. So what is one to do every time you have a good day and then followed by a bad day? Will you be looking for COVID-19 every time? A big question, not an easy one to answer, but I suspect the answer. So if perhaps you live in an area of the world that has been severely affected by COVID-19, your index of suspicion whenever a baby turns sour on a given day may be higher, but I would encourage everyone to be judicious in thinking about when to do these swabs. While one needs to be really careful, again, I worry that units across the world will struggle to provide proper isolation for all of these persons under investigation. So with that, I would encourage you, if you wish, you can go look at the Facebook page and see the report, which is available in full. Again, it's called Late Onset Neonatal Sepsis in a Patient with COVID-19. I think it's worth having a look at because it certainly will serve as a good reminder that even though we believe COVID-19 doesn't cause severe disease in neonates, because we've had very few cases of severe disease, this certainly is a case that presents in a 3-week-old who gets quite sick. And lastly, if you think this information, I mentioned this at the beginning when there were just a couple of people on, if you think that this information is of use to you, if you think it might be of use to others, feel free to share or like the post. If you certainly get something out of it, others might too. And I would like to thank those who have tuned in. I can see there's individuals from Baghdad, Vienna, and Munich. I always do like seeing where people are from, and I continue to look forward to providing you with updates as time goes by. And I would lastly add that I think I've mentioned this on a piece before, but as the chair of the Fetus and Newborn Committee at the Canadian Pediatric Society, we are checking into what the literature shows every week and updating our statements as statements or as evidence becomes available. I do anticipate there will be some changes coming up as we've had more literature coming out, such as case reports like this, and with changes in the evidence, you can expect that the CPS will send updates. And it's my intention that when updates come, I would like to hold little chats like this where you can ask questions about some of the evidence behind why we've made these changes, and hopefully you'll find those useful too. And I'd like to thank those from Portugal, Abu Dhabi, and South Africa from also tuning in. Again, nice to have a global community and to share knowledge across the globe. Anyway, take care everyone, stay safe, and I hope everybody has a very good weekend. Bye-bye.